Okay, I think it's 2 past. Do we want to give people another minute, or are we good to go?
Just seeing whether the participant number goes up a little bit more, but it's looking like it's stopping soonish.
Sorry, I can't see the number, so I'll rely on you guys.
One more just came in. And now it's stopped. Okay, should we start? Everyone good to go?
Yep.
Okay, Michelle, do you want to lose your screen, or you're good there in the background?
As in stop sharing?
I'm just going to talk loud and proud because I can't see whether people are seeing me, but hopefully they can hear me.
Ah, right. Is that better?
Hopefully the participants will be able to answer that. I would like to acknowledge the traditional owners of the lands across Australia and New Zealand on which we're gathered and pay respects to their elders past, present and emerging. I'm Associate Professor Donna Green. I'm one of the founders of the Climate Change Research Centre at the University of New South Wales. Myself, I work on public health, air pollution, environmental justice, obviously climate change, and I'm very interested in the intersection of all these particular disciplines. So I was very interested when Kirsten got in touch with me to talk about this issue and suggest I host this session because it was one of my curiosities to find out how actuaries did what they do. So I have a sneaky interest during this session and hopefully afterwards to understand what's going on from your perspective in relation to all of these issues. So this presentation today is going to be run sequentially with 3 speakers. We're starting with Michelle Don. Michelle is an R&D actuary working in life insurance at Pacific Life Re. Her research to date has been on focusing on the retail life insurance space, particularly on morbidity and mortality risks. Having previously worked in pricing, valuation and capital roles, Michelle is passionate about understanding the broader impacts of climate change, and she's a member of the Institute's Climate Change Working Group and the COVID-19 Working Group. Dr. Ramona Meyricke will follow her. She's a director at Taylor Fry, where she works with a team to measure, model and identify opportunities for better government policy and programs and health and disability systems and services. She has over 12 years experience working as an actuary across superannuation, life insurance, health and government sectors. Her work and research focus on the challenges and links to population ageing, health, morbidity and mortality risks, and management of these risks by individuals, companies and governments. She's an active member of the Institute's Climate Change Working Group. And finally, we'll end with Kirsten Armstrong. She's the director of 3 Rivers Consulting, where they help governments, businesses and health to deliver better health systems and greater social impact. She has experience in more than 25 countries and is a board director of disability provider Northcote. Last year, she was recognised, oh, this is fabulous, as one of the AFR's 100 Women of Influence. I didn't know that. If you were wondering, I just quickly stuck up a background of Climpact. It's a index that you might be interested in that some of our CCRC group works on. If you Google Climpact, you'll find it. And with that, I'd like to hand over to Michelle.
Thanks, Donna. Let me just quickly share the presentation and then we can get started. So can you all see that? Yep, great. So before we jump into the big questions, I'll provide a brief overview on where we are in terms of air pollution. So what we're looking at today is when the air becomes toxic, the health costs of air pollution and bushfire smoke. So relative to the OECD, Australia has had pretty good air quality, but that doesn't really mean that we have no problems. So historically, we've had some poor air quality hotspots in New South Wales, in particular the Upper Hunter region. So there's a global sulfur dioxide hotspot there because there are power stations and industries burning coal and oil. And also in Liverpool, Sydney. This area has exceeded the annual national air quality standards in 2010 to 2011 for exposure to particulate pollution by 25%, so that's quite high. What we know from studies that have been conducted overseas and also locally is that air pollution adversely affects respiratory, immune, and cardiovascular health. And more recent studies have shown there's actually no safe level of air pollution. So at every level, there are risks to people's health. As climate change impacts the frequency and severity of extreme weather events like bushfires, we have seen and expect to see worsening air quality and therefore increases in health risks. So as Donna has provided in her introduction, this presentation, our discussion will focus on questions around the health costs of air pollution and bushfire smoke. The four main areas we're going to cover today are, firstly, I'll take you through the air quality in Sydney before and during the 2019-2020 Black Summer bushfires. Ramona will then talk about the health risks and where the most vulnerable people live. And finally, Kirsten will go on to expand more about the health costs of poor air quality and the policy implications of that. So let's get started. Air pollution and Black Summer. Now, I'm sure most people in the audience would have experienced the awful smoke that blanketed New South Wales and ACT and parts of Victoria during the summer that had just passed. But before we go into how terrible that was, let's have a look at what exactly air pollution is and what the state is like before we have these extreme weather events. So this breakdown here that we see, this is from the 2016 State of the Environment report. Air pollution is quite a general term, so it refers to toxic gases and particulate matter. And there are different components of air pollution and they have different driving sources. So as you can see on this diagram, particulate matter is mostly driven by domestic commercial sources, whereas sulfur dioxide, for example, is driven more by industrial burning. So as I mentioned earlier, the Upper Hunter region has poor air quality and that's mostly driven by high concentrations of sulfur dioxide. The health effects of smoke are mainly driven by suspended fine particle matter. So these are the things that impact people's lungs, immune system, cardiovascular systems, and the top three that we can see on this diagram here. So the particulate matter, the organic volatile compounds, and the particulate matter less than 10 micrometers, they are the ones that are released when there are bushfires or when burning happens. So for this presentation, we're focusing on using the PM 2.5, so that's air particles less than 2.5 micrometers as a proxy for air pollution, given its links to health and to bushfires. So moving on, as we saw in that previous slide, most of the PM 2.5 concentration comes from domestic, commercial and industrial sources. For this presentation, we're looking to focus on Sydney in particular. The reasons for this are there aren't air pollution monitors everywhere in Australia yet. We hope that will change. The coverage is best in Sydney. So there are 16 stations in Sydney measuring the air pollution. And also, as Ramona will expand on later, this corresponds with some of the health modelling that has been happening. So this is what the average daily PM 2.5 looks like in Sydney in 2010-2011. What we can see, even 10 years ago, is that because of the topology of Sydney, the pollution inland is worse. This is driven by population density as well as industrial activity. There's a bit of reduction. I don't know if you guys can see my mouse. Hopefully you can. Yep. So there's a bit of reduction coming through from the coast, but this is very small. And as I mentioned earlier, most of the pollution is coming through from the high populations of cars and industrial activity. Note that the Liverpool area is still a hotspot even 10 years ago. So it was 10.1 micrometers and the national standard was 8. Okay, now let's do a quick quiz. Thinking back to a typical year, which is pretty hard to do these days, I'm sorry. What was the largest source of PM 2.5 emissions in Sydney in 2013? Hopefully the quiz has popped up on your screen. So I'll give you all a minute to think about the question, and then we'll see how we go.
Do we know if most people have answered?
Yep, the results are up. Can you all see the results on my screen? Yep, okay. So the largest proportion of answers is diesel vehicle exhaust, followed by road, brake and tyre wear, then prescribed burning and bushfires, residential wood heating and shipping. Well, let me quickly close this and show you what the actual answer is or was. So the main source of PM 2.5 emissions is actually from residential wood heating. This is not a feature specific to Sydney, and it's something that we've noticed when we looked at particularly Tasmanian data as well. So residential wood heaters drive a lot of the pollution that is ambient in the air without bushfires. One thing that we do want to note is that even in 2013, prescribed burning and bushfires had worse daily peaks. So it was more volatile. There were higher highs and lower lows, but on average, it was still less than residential wood heating. Now, of course, over the last summer, this proportion of air pollution from burning and bushfires has increased, and it's significantly higher than what we're seeing here. Now, this is what the concentration of PM 2.5 looks like in Sydney over 2019. I'll just click play on the video and hopefully it works. Okay, there we go. So as that is playing, it's ticking through the days, and we can see that is when the bushfires happened. From what we can see here, this is showing changes in weekly maximum levels of PM 2.5 in Sydney from all of 2019 to February 2020. Now, there is some seasonal fluctuations in PM 2.5, but we started to see spikes in high PM 2.5 from October last year. And the other feature to note is that the dispersion is much slower to happen in Western Sydney. So that's around that Liverpool area, and that explains some of why the air quality is so bad there. So I'll quickly play this again because I think the video went by a bit quickly, but I'll see if people can spot the features that I'm referring to in the presentation. Right, so what does this all mean? We're showing high levels of air pollution. We're showing that they're spiking up when there are bushfires and that they're normally caused by wood heaters. But what does this mean in the context of guidelines? What does this mean for people's health? Well, over the last summer, relative to the air pollution guidelines, we have had multiples of what the guidelines are showing. So the WHO air quality guideline for PM 2.5 is 10 micrograms per meter cube as an annual mean, and 25 micrograms for a 24-hour mean, so a daily average. In Canberra, the worst daily average was on 1st of January 2020. This was 34 times the guideline. In Sydney, in November, we had the highest reading of 790 micrograms per meter cube. This is 31 times the guideline. And over the whole Black Summer in Sydney, the air quality was hazardous on 28 days. This meant that it was more than 8 times the guideline. Given that we can see and measure how bad the smoke is, and some have felt the very real impacts of this, Ramona will now expand on the health impacts and what it means for vulnerable communities.
Just going to do a seamless transition.
Is it working?
Should. So thanks, Michelle. I'll talk about air pollution and how it impacts our health. So we're focusing in this presentation on PM 2.5, which is particulate matter 2.5 micrograms or less in diameter. And PM 2.5 is a common proxy for air pollution, and it's the main driver of health impacts because these particles are so small, not only can they penetrate deep into the lungs, they can also pass through into your bloodstream. And in the immediate term, certain people might experience symptoms such as wheezing, coughing, chest tightness when PM2.5 levels are elevated. But there are also more serious short-term and long-term health consequences. So even at low levels of PM2.5 exposure, if this is chronic, people are chronically exposed, there's been significant increase in research studies finding increased risk of cardiovascular disease, respiratory disease, and lung cancer. And more recent studies are showing that PM2.5 exposure also affects reproductive, urological, and neurological systems. So the impacts can be greatest when the air you inhale to your body mass is at a high ratio, and that occurs in young children, and impacts can also be greater when your organs are developing. So disturbingly, more recent research in a number of countries has shown decreased birth weight of babies when they were exposed to smoke in utero. And recent studies have also detected a link to COVID-19. When levels of air pollution are greater, the lining of the lungs is weaker, and so you are more exposed to contracting COVID-19. And if you do, the consequences or the risk of death and serious illness is higher. And as we go along, we're learning more about the health impacts. So previously, it was thought that you needed quite significant exposures, but in fact, a study from 2020 found that in terms of out-of-hospital cardiac arrest, 90% of those events are occurring when air pollution levels are under 25 micrograms per litre. So if you look at the air quality index, that's good green, good air quality, and that's below the World Health Organization limit. So Michelle spoke to the exposures during Black Summer being over 30 times that 25 microgram limit, if you like. So that's really what is classified as extreme exposure. The conditions that many Australians experienced is unprecedented, to use an overused word, but it's certainly extreme. And so you can consider yourselves part of an ongoing experiment, if you like, because very little is known about the consequences of extreme exposures on health. The one study that has been conducted and is ongoing in Australia of the consequences of extreme exposure to smoke is a longitudinal study called the Hazelwood Health Study. And this was started by the Victorian Government following a major fire at the Hazelwood power station in 2014, which kind of blanketed surrounding towns in smoke for a period of 6 weeks. And understandably, the residents in those areas were concerned about the health impacts. So there's an ongoing longitudinal study, and the emerging results have found ongoing respiratory symptoms in adults. So more than a year after exposure, adults reporting respiratory symptoms. And those children who were exposed either in utero or they were in their first 2 years of life when exposed to that smoke report higher level of respiratory tract infections and small increases in lung stiffness. So consider yourself part of history, if you like. And research is likely to be ongoing following Black Summer on the health impacts that has on Australians for decades to come. So within any population, there are more vulnerable groups, and we do know quite a lot about who is most vulnerable to air pollution. So the very young are exposed, and that's because of the size of their lungs relative to what they're breathing in and the fact their organs are developing. The elderly are exposed because they are more likely to have comorbidities and weaker immune systems. And socioeconomic status has been shown to play a role. So if those of lower socioeconomic status might have poorer quality of housing, so they are more exposed to air pollution, or they might have less ability to put in place measures that protect them, such as buying an air purifier or taking time off work to stay indoors during one of these periods rather than go outside and work an outdoor job, that those opportunities aren't available to them. And some other studies have also shown that the road density in a neighbourhood and the walkability of your neighbourhood affects your exposure in two ways. One is traffic emissions, but the second is neighbourhoods with higher walkability have more incidental exercise in their communities. So you might walk to the shops, and that has the protective effect against comorbidities. So many of these factors are interconnected. And what we've done is create an index, if you like, by combining publicly available sources on, I'm just trying to change the slide and having some trouble. Combining publicly available sources on comorbidity, the socioeconomic status of an area, the proportion of its residents aged over 65, the proportion of residents aged 4 or under, and the road density in an area. So these variables have been combined at SA2 level for Greater Sydney, and most of these variables come from the census. So the base reference year for our measure of vulnerability is 2016. And when we combine them, this is the picture. So we see a fairly dispersed pattern. So it's not uniform in any sense. For instance, this region of Sydney, which is North Randwick, it's quite a big district, but it has relatively high vulnerability compared to surrounding areas, driven by the age structure of population and also the road density. But to simplify the results of this index, what we see is that the areas with the highest vulnerability tend to be inland in Greater Western Sydney, in this kind of semicircle, Liverpool through around Parramatta. And that's particularly concerning given the results that we shared earlier, because there's this intersection between vulnerability and exposure, which is unfortunate. Because of the prevailing winds, air pollution will typically be worse in this band from Parramatta to Liverpool. Sorry, Michelle, could you step in? There we go. So here, this is what I'm referring to, is this intersection between vulnerability and exposure. So any public health measures in future would could potentially target these areas and the factors unique to those areas. So just on the next slide, another complicating factor is that Greater Western Sydney is a growing area. The population is projected to be 3 million by 2036. And it's already has strained adaptive capacity. So the Greater Western Sydney councils are particularly concerned about urban heat island challenges. Greater Western Sydney is one of the areas that suffers the most during heat waves. And there are interactions between emissions and climate change will serve to both reduce air quality in the future and increase the frequency of heat waves. So I will now hand over to Kirsten, who will talk about the health costs.
Right. Is that okay? Is my screen, hang on, I need to do that. Have I got, is that working now? I hope so. Anyway, I'll assume that's working. I'm sharing my screen now, so apologies if it's not quite working. So what we wanted to do was try to look at the health costs of air pollution, as well as the impact of the bushfires in terms of the dollar cost of that. And we've looked at data for all of Australia. I'm conscious that the presentation so far has been a little bit Sydney-centric, although partly that was because that's where we could get good air pollution data from the air monitoring stations. But when we looked at the burden of air pollution in Australia, we drew data from the Institute of Health and Welfare's Burden of Disease study. So this is a very comprehensive study that's done every 5 to 10 years, and it's done as part of a global study. So it's a real global effort to use loads of literature and analysis to understand the burden of disease in most countries around the world. And what this study does is look at the number of deaths, chooses a particular year, in this case it was 2015, looks at the number of deaths, the numbers of years of life lost as a result of those deaths, so looking at the age of the people that died. It looks at also from the different conditions, the different disease conditions that people have, how many years they were lived with a disability, and it adjusts those years lived with a disability for the extent of the disability that's being lived with. So for example, if it's a condition like asthma, that might be a minimal impact in terms of disability. People might say that's only a 20% reduction in quality of life. If it's something that's extreme pain or blindness, or something where you can't participate in activities of daily living, for example, then that might be 80 to 90% loss of loss of ability. So those years are weighted more in this study. If you've got a greater level of disability from your condition, they get a greater weighting. And the years of life lost are added up with these disability weighted years to come up with a term called DALYs, this disability adjusted life years. And that's really the currency that's often used in healthcare to talk about the value or the real burden of a disease. And we make investment choices in healthcare based on what that burden of disease is going to be. If we're willing to pay more for a pharmaceutical product, for example, on the PBS, if we know that we will save more DALYs. So across Australia, in 2015, cancer was the biggest burden of disease in Australia. That's multiple cancers, lung cancer is the biggest one, and cardiovascular disease, musculoskeletal and mental health follow that very, very closely. The study does two more things. Obviously, it's a very complex study. It breaks this down into a matrix based on the age of the people experiencing those conditions. And that's why mental health is something we talk about a lot, because that's something that's experienced particularly by people of working age. The other thing it does is also look at risk factors that causes those conditions. So for example, lung cancer is caused predominantly by tobacco smoke. So what it does is say, so what the study does is try to estimate what proportion of the total burden of disease is actually caused by modifiable risk factors. And for the first time in 2015, the study actually included air pollution as a risk factor. And what the study did was use a whole bunch of published literature, including some of the references that Ramona's talked about, to estimate what proportion of certain diseases, or the burden of certain diseases, was caused by air pollution. And so the study focused on 5 core conditions, and this is globally. So this was done, these 5 conditions were done globally. So coronary heart disease, it was found around 7% of the burden in Australia is caused by air pollution. Stroke, around 4%. COPD, chronic obstructive pulmonary disease, so that includes things like emphysema, around 3% of the burden. Lower respiratory infections, so things like bronchitis, pneumonia, etc. And lastly, lung cancer, about 1%. So taken as a percentage of the total burden in Australia, that's just under 1%, so about 0.8% of the total disease burden in Australia was as a result of air pollution, and around 1.6% of deaths, so around 2,700 deaths in 2015 were a result of air pollution. So quiz time. What I'd like to ask each of you, so we've just talked about air pollution and what it contributes to the total burden of disease in Australia, so 0.8%. So what I'd like to ask each of you to answer is, which of the following risk factors contribute more to Australia's burden of disease than air pollution? So high sun exposure, a diet high in red meat, intimate partner violence, so domestic partner violence, all of the above or none of the above. So just take 30 seconds to slot your answer in there. Fantastic. All right, so the two highest rating answers there are high sun exposure and the last one, all of the above. So actually all of the above sort of scored the highest. All right, so you'll be intrigued to know, you can close that now. You'll be intrigued to know that the answer is actually none of the above. And I've got some data here from the burden of disease study itself, which highlights some of these. And the reason I actually did this quiz is because I think that some of those other things, like sun exposure, like in red meat, domestic violence, etc., are very, very high profile in the media, but we don't actually hear so much about air pollution. But actually, air pollution and high sun exposure are equivalent, which I found really interesting. A diet high in red meat was far lower in terms of impact, so just 0.3%. Although what I do want to point out for any of the meat eaters there, I'm vegetarian, I'll put that out there. If you look down the bottom left-hand corner, diet high in processed meat, so that's things like ham and bacon and so on, that's actually a much higher impact. So if you're eating both, that's not doing too well for you. And intimate partner violence also a little bit less than air pollution. So I guess the reason I wanted to put this out there is that my view is that air pollution just isn't getting a strong enough play in the media, and I just think it's something that we need to start to focus on a little more. And for those of you who might have forgotten what that time was like, I experienced asthma, and I made a call at some point that it was time to get out of Sydney because I was really struggling with the air pollution, and I drove up to Queensland and stayed with my parents for a month over Christmas and New Year. And this was actually footage that I took on the way up. It was taken near Glen Innes, and you know, you can see that it wasn't just places like Sydney and Canberra and so on that were affected. Across Australia, you know, this is halfway between Sydney and the Queensland border. You can see just a startling, really startling level of air pollution just across the country. It reminded me of a scene from Mad Max. So what about the impact of all that bushfire smoke this year? There was a study published in the Medical Journal of Australia that estimated, using all those factors that we just talked about, what the additional health impacts were in 2019-20 as a result of the additional bushfire smoke that blanketed the country. So these are Australia-wide estimates. And that study estimated in excess 400 deaths from bushfire smoke, over 3,000 hospital admissions for cardiovascular and respiratory conditions, and over 1,300 emergency presentations for asthma. And that's just based on the short-term impact in that. As Ramona said earlier, we don't know a lot about the long-term impacts of that exposure. So what we've done is taken that data and tried to estimate the dollar cost associated with that. So in a typical year, on the left-hand side, again, taken from that 2015 burden of disease study, as well as some other work that the Institute of Health and Welfare does to estimate the health expenditure for each different type of disease condition, hospitalisations, medications, everything else is a very detailed study that they do at the same time as they do that burden of disease study. And using the estimates there, we've come up with a number of around $283 million health expenditure in a typical year that arises as a result of air pollution. But the burden of disease cost, so those DALYs, those years of life lost and years lived with a disability, the value of those is around $8 billion. Now, to come up with that number, we use a government advised number. It's a number that's used by the Department of Prime Minister and Cabinet of around about $200,000 per adjusted life year. That includes the impact of lost productivity. It's basically based on what a willingness to pay estimate. What are we willing to pay as a society for gaining back that year of life lost? And you can come up with that estimate by looking, for example, of what we're willing to pay for medications or vaccinations or treatments and so on. But it's about $200,000 per DALY. If we just wanted to focus on the productivity lost, it usually works out to roughly a third of that number. On top of that, for 2019-20, we've got the additional cost of the bushfire smoke, and we've estimated that is at least $37 million in direct health expenditure, and another $1.2 billion in terms of burden of disease cost. So what's the policy implications of all of this? So to me, the key is, well, is it going to change in future? Is it going to get worse or is it going to get better? And most of the signs going forward are that air pollution will actually get worse. So Ramona already talked about population growth, and we know that with climate change, we're going to see more bushfires. The extreme fire situation that we had this year was considered 30 to 80% more likely to happen because of climate change than a century ago. But if average global temperatures rise by 2 degrees, actually it becomes 5 times more likely. So we know we're going to see more bushfires, and we know that to manage that, we're going to have more burn off. So we know that air pollution through bushfire smoke is very likely to get significantly higher. The other factor in that is heat waves. It causes stagnant air, so that means the pollution doesn't move as quickly as before, and it also increases surface ozone levels. There might be some improvements in terms of car emission and fingers crossed renewable energy, but we also don't know what's happening with wood fires. Are more people putting wood fires in, and are we going to see any improvements there? So for me, the signs are all that air pollution is going to get worse before it gets better. Policy implications. Look, we've taken a bit of an approach here, which is, an approach you might take into managing risk. What can we do to reduce the risks? What can we do to reduce the hazards and manage those better? So starting on the left, let's tackle climate change. I'm not going to talk about all the ways one might tackle climate change, but what I just wanted to point out is that if we tackle climate change, it's going to reduce the risk of future bushfires and bushfire-related air pollution. I think that given the data and evidence is so strong now, that when decisions are made, we need to be better including the impact on future healthcare costs in economic decision making when we make choices about investments, infrastructure and so on. And I just wanted to point out that when we switch to renewable energy, that can also directly address air pollution as well. So talking in the middle section about reducing air pollution near populations, we know that going forward, there's going to be a need to do more burn-offs. It's something that's been discussed quite a lot in the media. Well, can we manage them better? Can we do some modelling to actually work out what are the best days to do that, so that the smoke actually moves off and doesn't sit on some of the most populous areas? And of course, there's a need to look at better emissions management. We saw that wood smoke, that residential wood heating is a really major issue, and of course the impact of vehicles and industrial air pollution. And lastly, there's going to be an ongoing impact from air pollution. We know that we're not going to perfectly manage climate change. Okay, let's actually, in the end, make sure that we're managing the health risks associated with the increase in air pollution, and we're doing that effectively. One of the interesting things for me of the bushfire season was how poor the advice was for people who had asthma and other high-risk conditions in terms of what they could do to manage that risk. You know, there was some advice for a few days that said stay indoors. No evidence that that actually works. Probably the best advice they eventually gave was to tell people to go to shopping centres and so on, where there's air conditioning that filters some of the impurities out. You know, this is something that we're really going to have to address far better. And advice for people who are workers, particularly workers outdoors, is that really feasible? Look at preventative health. You know, we need more people with your asthma management plans, but other management plans for COPD and so on, so that they know they've actually put in place all the things they can to manage their own personal health risk. And the last thing I wanted to raise was greater transparency. You know, we've seen lots of images about, you know, the climate impacts on erosion and these sorts of things, coastal properties being washed away, and there's been a call for us to be more transparent about climate risks that are physical risks, for example, you know, properties becoming flooded or washed away. Well, I think we've now got really strong evidence about high pollution zones. So, you know, I really think we need to start thinking about greater transparency about those high pollution zones, so that people who are at high risk from air pollution can actually make their own choices. So with that, I'm going to stop sharing my screen, I hope, and hand over for questions.
Thanks, everyone. On everyone who I can see's behalf, I'd like to thank Michelle, Ramona and Kirsten. I'm just going to let everyone have the opportunity to put some questions in that Q&A chat box. We've got one there to start with, but I won't do that just now, to just allow people to have a think about it, and if they've got any questions, to fill that in. Apologies to people on the phone. I'm just going to do a little show and tell while we wait in case questions come through, because I just remembered as this was going that I had a nice piece of tape. I don't know if people can see that. You see those little dots? That's actually the PM 2.5 bushfire smoke reading. So that was from Roselle. There's a very fancy machine, expensive machine, that moves along and actually tests the 2.5 reading. So once the little piece of paper that moves along gets too much pollution on it, it has to move on to another piece to be able to test it. That piece of paper normally gets moved along every 2 to 3 weeks, because that little dot is normally, you can hardly see it. But when I was talking to the technician there, I mean, he gave me that because I was so shocked when I saw the dark colour of those dots. And he said he was having to move it every 2 to 3 days. So to me, it was a very, very visible and tangible ability to show essentially what incinerated koalas look like to an air pollutant. I'm going to show it to you again. Sorry, you can only see it on me. Those dots, you shouldn't really be able to see anything there. They should be the palest little circles over 2 to 3 weeks. So, having said that, we do have a couple of questions there. Please feel free to continue to put them in. I've been asked to read the questions because I understand that some people are just on the phone, so if you'll permit me that. I'm just going to go with the first one that came through because it was an interesting one, and it's close to my heart too. So this is from Chris. With children being more vulnerable to smoke pollution, I was surprised to see the lack of basic adaptation at my kids' school last summer. For example, in the morning, all the doors and windows were open when air quality was obviously awful. Do you think public buildings should have mandatory adaptation policies for poor air quality? If any of the presenters want to tackle that, or I'm happy to begin. Or
happy to have a go. My sort of first, or our first sort of recommendation around anything to do with this is that we actually factor in the health impacts into decision making. And the question you're asking is exactly doing that. How do we actually, when we do a cost benefit study of a change to infrastructure, do we make sure we account for in the benefits the impact of improved health if we decide to do something like that? I'm not aware of studies that have actually looked at the costs and benefits of making that choice. I suspect it would come out well in some circumstances, but not all. And I don't know, Donna, if you have an answer to that that's any better than mine, but I think that there's a need for a bit more work in that space to consider how to adapt buildings and so on to make them improve health outcomes.
Did Ramona or Michelle have any?
I guess I'd just add, yeah, we know children are more vulnerable. We know that the elderly are more vulnerable, and in any public health messaging, those more vulnerable groups should be targeted first. So, for instance, with heat waves, it's advisable that aged care facilities have a plan to look after residents in a sustained heat wave. And similarly, I think that's a great idea. There should be guidance on how to protect school children. And the New South Wales Government ran an inquiry, a 2020 inquiry. It had its hearings just 1 month ago into the health impacts of air exposure. And one of the experts who presented there kind of fast forwarded to 10 years in the future. And he said the way that we think about hats now as part of the school uniform, so no hat, no play, in the future he anticipates a mask will be part of school uniforms. And on sports days, there may very well be a situation where you can't participate in a sports day unless you're wearing a mask as a child. So yeah, it's a pretty, for me, that was a really visual and sad future. But the important thing is that there are a number of things we can do to control the situation and create a better future for school kids.
I'd like to add to that, just because it happens to be an issue very close to my heart. A lot of these air pollution readings are from what's called ambient or outside monitoring locations. There's a very specific set of criteria as what is allowable for one of those areas to be reading. And in schools, it frequently doesn't equate. So one project that I'm very keen to get up is to put some paired air quality monitors inside a school where school children actually are, and in the playground, and to work out how much air pollution is getting in and whether closing, opening windows, using air conditioning, using air purifiers, what type of carpet is on the floor will either improve or reduce the quality of air during an air pollution event. So Chris's question was absolutely right, it's a problem. New South Wales doesn't have any official guidance right now, the ACT does, but there are difficulties that have not yet been resolved around things like ventilation. So it makes a common sense approach of, if there's an air pollution event, close everything down to try and keep the cleaner air inside the building. But at the moment, there is no question or no ability to give the school principal advice when they should open up the building, because at some point the air pollution will leak in, and it may be that if there's a change that goes through, the outside air is cleaner, so you need to actually flush the air out. But at the moment, there's no guidance on that. There is no guidance as to one of the rooms being a better room for vulnerable staff and students who may have asthma to be relocated to during event. There is no guidance. So come back to me in a year. I'm hoping to get some monitors put out in schools so we can start to address that issue, but it is definitely something that is a problem in New South Wales at the moment.
And Donna, on a related point, I'm not aware of guidance for workers either. So Safe Work Australia would normally issue guidance, and they've issued quite a lot around COVID-19, but it seemed pretty lacking in relation to air pollution. They've certainly got heatwave guidance.
Yes, you're quite right. So we were working with the dock workers in about, I think it was November last year, because they're workers, so obviously in outside occupation, doing very physical work. It was very hot, they do long hours, and the air pollution was terrible down there. And they were told they had to continue working, but some of those workers decided they had to stop working down tools equivalent because they thought it was unsafe. And so there became a very tense moment with the unions there as to what they would do, because there's no monitoring at that site. And so they were using the closest available data to try and work out what a reasonable limit was where they should stop. So in that particular case, and I'm sure that would extend for other outside occupational work, at the moment there's very limited guidance. People are scrambling to catch up, and that's before you start factoring heat and humidity, which in Australia, especially in Sydney, is a real concern. Yeah. And we've got another couple of great questions, and I know I've got 9 minutes to shoot them at you, so I'm just going to quickly go on to Jennifer's question. Actuaries always love good data. I wonder if we should also be calling for better air pollution data across Australia. I was surprised to hear that other parts of Australia are not as good as New South Wales. And great presentation, everyone. Anyone to take that on?
Do you want to go, Michelle? Go.
Oh, thanks for the question, Jennifer. I absolutely agree. We should be calling for better air quality data around Australia. I think what putting together this presentation has taught us is that there are quite a lot of gaps in just the monitoring of air quality data and also our understanding of it too. So speaking to someone from Tasmania on their air quality monitoring stations, he mentioned that the technology there is not as good as what we have in New South Wales, and that's down to funding and decisions at that level. So yeah, to short answer to your question, yes, definitely we need to put in either more monitoring stations or better reporting of the air quality data that we have, to better understand these risks and to analyse it. If there's anything you guys want to add?
Yeah, look, there's also some modelling being done that uses, in addition to the monitoring station, uses satellite imagery to, you know, you might recall that there were satellite images that showed the progression of the bushfire smoke across the country. And there's actually work that's been done to sort of use that sort of information as well as data on wind and these sorts of things to actually try to get estimates for all the sort of locations in between the monitoring station. So that's one other area that could be improved. And then, but just also on health data, you know, the estimates that I showed, you know, an additional 400 deaths and so on, and you'll know this well, Jennifer, that it was based on estimates because there wasn't actual real live data to look at the number of deaths that actually occurred at that time, and it gets lagged for 3 months. And the hospitalisation data, that's not going to come out, like it comes out generally on an annual basis. The data for that period won't actually come out for about another year. So, you know, I think there's a real opportunity to get quicker and more valuable data to help understand impacts and make decisions.
So just briefly, I think Kirsten was referring to what's called Air Rater, if you want to look it up. There's an app that was just in the Northern Territory and in Tasmania that was opened up to be the big states as well over the Black Summer, because of the need for people to have some better sense of what the lightly modelled air quality reading was in their area if they were too far away from an actual monitoring site. Legally, there's meant to be an air quality site for about, I think it's 25,000 people. So that does cover sort of, in a sense, so if there's a smaller rural area, lower than that number, it might be optional whether you have an official government site or not, but the government is trying, or New South Wales government is trying to roll out more monitoring stations in more remote areas, but their equipment is quite expensive. They don't use the sort of smaller, cheaper, faster, dirtier. So it's a slow process. So there is that issue about the monitoring data that comes from those government approved sites, and then also whether you can use interpolated data. But I totally agree with Kirsten that the issue, I would say, is more the health data, which is slow to get at. The air pollution data you can just request online from New South Wales Government and they'll send it to you. But the health data takes longer to get hold of. I'm just going to quickly turn to a few more questions because hopefully we'll be able to get through the ones that are up here. From HD, have such costs been discussed in the Bushfire Royal Commission that's just going on at the moment, or do you expect them to be discussed in upcoming hearings? Does anyone know the answer to that?
I sat in on the sessions of the Royal Commission into Natural Disasters presented by the Actuaries Institute, and certainly the issue of air pollution didn't come up. The deaths, the mortality and morbidity measures discussed there focused on natural disasters and heat waves, but as air pollution isn't considered a natural disaster itself, they would be picked up under bushfires, but typically, you know, the number of people, for instance, if you take an event like Black Saturday, the 2009 fires in Victoria, a large number of people died in those fires and they would be measured, but a far greater number would be affected by air quality, and that didn't come up in the Royal Commission.
We might just try and get another couple of questions if that's possible. So Pichol, sorry if I didn't pronounce your name correctly. Are we more exposed to indoor pollutants or outdoor pollutants? And are air purifiers going to make the biggest improvement in air quality? The further comment is that people were once very worried about radiation from electronic devices, only to learn later that background radiation is actually the dominant source of radiation that we're exposed to. And Kirsten, you're mic'd off.
Sorry about that. So I was probably surprised to see how important residential wood burning was to air pollution. So, you know, about 30% of the impact in terms of PM2.5 particles. Obviously, there's a lot of other things that go into air pollution. I wouldn't say that that means that the greatest impact is internal sources. I think that the greatest impact is still the external sources, but it's very significant, those internal sources. And I do think that there's an opportunity. I think there's an education opportunity there. As I said, I was quite surprised to see how high that was. And I'm not sure that people actually really understand the importance of some of those things that they do have the ability to influence and change.
And also recognition that people spend a lot of time indoors. So an ambient outdoor reading is not necessarily the exposure that people are receiving. Okay, Brendan, who decides on rollout and placement of air pollution monitoring stations? Without data points, harder to develop policy and inform advised responses. Is this state or federal? I just briefly mentioned that. It's actually a national process that the states then sort of take on and enact themselves. So there was the old Office of Environmental and Heritage in New South Wales Government, being selfishly based in New South Wales, which I'll answer for. That's now has a different department name, but essentially the same thing. They're responsible. I'm just, sorry, keen to get through to the last two questions, so I'll just have time. From Anonymous, great analogy, Kirsten, about the physical risks of climate change that are frequently thought about with property damage, etc., but not people's own bodies. Despite this session showing the importance of the latter, do you have any sense of the relative costings of these different types of physical risks, property versus bodies, or how else can the message get through about the relative importance?
Good question. I don't, but I think that some of that work would not be too hard to do. So I think there's an opportunity to compare it to some of the other estimates around about the impacts of climate change in particular. Ramona, I don't know if there's anything you wanted to add to that?
No, I think, yeah, just public education, really getting the message out there.
Yeah, and I think, so I think there's an opportunity to do a bit more work to actually start to answer some of those questions. And we're going to have a think after this presentation about who might be interested in supporting some of that work. There's a few players who obviously have an interest in this space. So I think, you know, I think that with just a small amount of work and some additional research support that we could get there.
We just have one sneaky last question from Chris that I might read out and sort of quickly answer if that's okay to everyone. We're just 1 minute over. Can we improve data available to the public? E.g. in New South Wales, the advice is based on a rolling 24-hour average from a station 30k away. Not up to date and not too far away. I've got so frustrated with it, I bought a home sensor which really shows the difference to the official data. So just briefly, go and look up air rater, air as in AIR, rater, R-A-T-E-R. That will give you probably possibly a slightly conservative, smooth reading for your local area. And what has also happened with the New South Wales data, assuming that's where you're based, is that they have allowed, I think, the 1 hour PM2.5 to go up online. So you can actually get that data from the site directly. They're developing apps so you can download stuff. Be a little cautious with the home sensors because they may look great, but they're not actually calibrated against an official sensor, which means that they can spike, they cannot be that accurate. So they can be good for guidance, but I certainly wouldn't be relying on a home sensor for a value. So it can confirm what you're maybe thinking, that, you know, you've got bad air pollution in your house, but I wouldn't rely on that number over, for example, the air rater sat interpolated data from government monitoring sites. With that, I am going to very rudely just say, I'm sure you will have a cup of tea to get to at 3:01 or another session. It's been delightful on my first time I've tried to do this. I was scared senseless not being able to see any of you, but thank you all the participants, and do get in touch with Kirsten, Michelle or Ramona, and they can get in touch with me, and hopefully we can take this work further. And thanks to our fabulous sponsor.
A big thank you to you also for stepping in. It's been fantastic, and your knowledge in the air pollution space is fantastic.
Bye-bye, everyone.
Thank you.
Bye.